People talk a lot about breast implants, but a lot of the discussion is really just about size. And size is important, of course, but there's a lot more to it than size. So let's break it down into some easy, demonstratable differences. We're going to talk first of all about profile. So a profile, if you look at these implants right here, these implants are all 12.5 centimeters wide. So they all have the same width and they have different profile or projection. The most common projections in breast implant surgery are usually what some companies call a medium or a full. This is extra projecting, which has some use, and this is low projecting. I tend to use it more when we really have a situation where the breasts are uneven or somebody is really small framed and they only want a little bit of augmentation. Another thing that happens is people come in and they're very volume based, but an implant surgery can't just be about volume. So these implants are all within 10 cc's of each other in terms of volume. They're all about 340, 350 cc's. And you can see there's a remarkable difference in these implants in how they look. So which is best for the patient? Well, again, we're going to examine the patient, we're going to measure the patient, we're going to see what their goals are, and we're going to figure out what is best. Also, implants have different gels, and there's a characteristics to each gel. Okay, this gel might be softer, but when the patient moves a certain way, it may ripple a little more and empty out of the top a little bit more. This implant is a different gel, more cohesive, or maybe what you'd call more gummier, and when the patient moves, the implant will ripple differently, or actually less, and there may be less that you can feel. So this may be more important in a girl with thin tissues and less important in a girl with thicker tissues. This is a very cohesive implant, and so it's firmer or gummier, and it's the most cohesive implant. This is an implant usually rarely for primary augmentation, but sometimes in redo augmentation and in other circumstances. So there you have it, implant education based on either diameter or projection, or just the fact that the volume is not the key issue, and also how do you want your implant to feel.